Good evening, everyone. Thank you so much for joining us tonight. We are so thankful that you chose to take 30 minutes out of your evening and join us to get more education on this amazing technology that is truly changing lives. Please know that whoever invited you to the call must really care about you to want you to know about this technology. We are just so blessed and honored to be able to share it with you tonight. The call will be for, like I said, about 30 minutes. We're going to start with our medical disclaimer. So, tonight, what we'll be sharing is for informational purposes only. All Lifeway products are not intended to treat, cure, diagnose, or prevent any dis-ease. If you're on medications or have medical conditions or pregnant or nursing, please make sure to consult your healthcare practitioner first. So, with that, we are going to talk about this amazing little patch tonight and explain how this works and dive a little bit deeper into the technology. So, this patch and this company is actually recognized by the FDA as a general wellness product. It is a class 1 medical device. It's completely non-transdermal, meaning there is nothing that transfers from this patch into your body. Most people are used to a nicotine patch, an estrogen patch, a vitamin patch. Those all transfer something from the patch into your body. This is completely sealed on both sides and does not transfer anything into your body. It is a light therapy product. And so I'm going to be explaining that here in a little bit more detail so you can understand. It is a medical grade plastic, completely hypoallergenic adhesive. This technology has a 96% effectiveness rate. That is just out of this world when you are talking about this marketplace and being able to have a technology that has that high of an effectiveness rate that can be seen in blood work testing, in thermographic imaging, in energetic testing, which are based on meridians in your body, which are all those meridians are actually teeny tiny collagen fibers. So it's all completely scientific in how this works, which is just amazing. So even if you're not feeling the technology, even though some people will fairly quickly sometimes, just know that you can have any of those tests run and see that it actually is making changes at the mitochondrial level in your body with what's going on with this technology and how it works. It is completely patented. We have over 150 patents. There's over 90 clinical studies. There's no product in the world that does what x39 does. The only thing that even comes remotely close to what this technology does is actually a stem cell injection. Those are thousands and thousands of dollars that may not always work, that only go into one area of your body. This technology does that. And actually, like I said, 96% effectiveness rate, and then does so much more. Goes systemically throughout your body, supporting your body. And the coolest thing is that your body gets to decide where it's going to send those stem cells. That is what is truly amazing. What's going to be supported in your body is your body's decision, not something that's trying to be forced. This technology is pennies on the dollars compared to the thousands that you will spend. You'll be able to use this technology for many, many years by the time you even got remotely close to what you would spend in a stem cell injection. So let's break this down and how this works. The patch on the inside there is made up of organic amino acids, salts, and sugars in a crystal lattice structure. So making a lattice that's actually reflective. And it so basically just works like a mirror. It's actually reflecting your own body's infrared light back into the body, turning on and signaling specific peptides to tell them, get up and get working, as if you were at a younger, healthier state. They worked at that higher level when you were below 25, and now we're telling it we want it to work like that when we were younger and healthier in that way as well. We'll go more into that in a minute, but let's just start with a process called photobiomodulation. That is just a big word for light making change in the body. This sounds like it's very confusing, but you already understand what this is because every time you step out into the sun, you can probably see the sun hitting my skin right here through the window. When the sun hits your skin and your eyes, it tells your body to make vitamin D, and then your body sends that vitamin D out to be utilized by the body wherever it is determined that it needs to go. So that is a normal process that happens with the sun. This process for this technology also uses photobiomodulation, but you are the light source. You are the heat source. Again, this sounds crazy, but I'm going to break it down for you and it will make sense. When you're watching a movie, and on those movies, you're seeing people that will sometimes look through night vision goggles, and they're seeing all these different colors and they're calling it a heat signature. That heat signature is scientifically a low-grade infrared light. That light emits everywhere outside of your body. It's why they can see you in those night vision goggles. It's coming out everywhere on your body. So you could actually put this patch anywhere on the body that you would like to put it on, be it in a pain spot, an issue spot. If you just feel like it needs to go in a certain spot today, you can put it there. It will work no matter where you put it on the body. We do have clinically tested spots, but the company has been around for over 20 years. So we can tell you that we know that you can put it on whatever spot on your body that you'd like to, and it will turn on that peptide. So that is what's happening. That reflection is happening, turning on GHK copper peptide. So that peptide is this amazing peptide. It is known as the holy grail of healing in many scientific circles because of what this peptide does in the body. The first thing is what I already told you about is stem cells. Your body will send those stem cells that are being rejuvenated and reactivated to whatever source that you need in your body for health and healing to sustain your life. So you may not know if there's anything going on in your heart, in your liver, in your lungs. You may not feel any of those things, but your body knows if there's an area that needs to be supported. So it's going to send it there first. So you might have an issue on your knee and you have pain in your knee and you're like, Nikki, it's not working. Well, it's because this technology goes to what area you need it first. So it's going to take some time to work through its process for your body because your body's getting to decide. We might put it on the knee. Some people might experience relief in the knee, but some people may not, depending on if that's, what's going on with you and what your body decides. Everyone is different. So that's the first major body system that gets activated and elevated. The other thing I should tell you about stem cells so that you understand is that by the time you reach 30, half of your stem cells are no longer working at their optimal level. They start to decline. That at about 50% by the time you hit 30 years old. That's why between 30 and 60, aches, pains, illness, disease, all those things kind of start to set in because those stem cells are continually degrading. By the time you're 60, there's only about 10% that are any longer operating optimally. And so this technology tells those stem cells, hey, I'm still alive and I need you to work like you were younger when you were before 25. We want you to work at a younger, healthier state so that you can go and do all the things you love and enjoy and put a stop to illness, aches, pains, disease. Have those things slow down. Have them never happen because your stem cells are able to react to whatever toxins, whatever issues you're exposed to. They are up and running like when you were young. So you see your kids, they fall off their bike, they get back on and they just keep going. I told this story last week. It always makes me think of my mom. Grandma falls off her bike and she's not getting back up. So my mom, it was before we ever found this technology. It was actually probably like 10 years ago. Actually, maybe even longer than that. For sure 10, 15 years ago, because she wants to go out and play with us with the kids. She actually fell over the top of her handlebars, went over the top of her handlebars, down under the ground. Yeah, Grandma was not going on a bike ride that day. There was no we were getting back up and getting into the house. So whereas my kids would fall off their bike and they would get back right on and we would just keep trucking down the road. So this is what we're trying to reset our bodies to that younger, healthier state. So we can just keep going, so that we can continue to enjoy life and do all of the things that we want to with our families, with our kids, with our grandkids. So activating those stem cells is one of the major things that GHK copper peptide does. The second is that it supports your entire cardiovascular system. So this is huge. Every 6 weeks that you utilize the technology, it reverses the age of your entire cardiovascular system at the mitochondrial level by 8 weeks. That means that as you continue to utilize the technology, it truly has a compounding effect on what's going on in your cardiovascular system. Truly amazing. Supporting the lining of your blood vessels, the entire heart at the mitochondria level. So truly reversing age, even in what's going on in your heart. So that is truly incredible. I don't know anyone who wouldn't say, are you kidding me? I can put on a patch and get that kind of support for my heart. Yeah, please sign me up. So that's two. All in one tiny little patch, okay? If you actually Google GHK copper peptide, I'm only going to talk to you about 5 things. The list is actually really long because they found GHK copper peptide over 50 years ago. Dr. Lauren Picard found it. Here is one of his books. Oh, sorry, my screen. Well, oh, nope. Normally it works. Maybe it's because the sun's coming through my window. There is a book. Type in his name, Lauren Picard, Pickart, and you'll find one of his books. If you want to geek out on the science like me, I love all that kind of stuff. But there's 50 years of research that's gone on with this peptide. So they know a lot of things that this peptide actually does in the body. The third thing is support your brain. By about 6 weeks, a lot of people, the clinical studies show that their depression, anxiety will start to lift. Brain fog starts to lift. You start to think clearer, so that clarity's coming back. I know for me, all of a sudden, like I was asking my kids questions, like I would ask them a question, and then a few minutes later, I'd say, I am so sorry. I know that I asked you the question, but I don't remember what your answer was. And they'd always be like, Mom. Anyway, so I was so thankful because obviously, like, when that stuff, like, we just blow it off and say, okay, we're just aging. But like, when things about health, that was concerning to me. Like, I was like, oh, I got to figure out what I can do with, like, I need to, see what I can do about this. Of course, I've taken ginkgo biloba, like you take all these supplements, just trying to help, but you're just shooting in the dark. Whereas this, I know GHK copper peptide supports my brain. And so that's one of the things that lifted for me was that clarity came back. I was able to remember things really and truly, so much so to where I remember things like when I was younger. I would remember full conversations with people. That was very common for me. That's all come back. So I am so thankful for that with this copper peptide. Okay, so fourth major system, collagen. Most people think that collagen is just hair, skin, and nails, which, yes, are we all thankful that we can have this benefit in our skin, that our hair can begin to grow again, that our eyebrows aren't completely disappearing, that they're growing again? Yes, we're thankful for all of those things. What most people don't know is that collagen is actually the glue that holds your entire body together. So your ligaments, your tendons, your cartilage, your fascia system, the meridian system in our body, that's not just esoteric. It's actually scientific with these teeny tiny little collagen spindles running through our entire body that allow our brain to talk to every single part of our body. A lot of people think of it as, they call it that energy system. It's running on collagen fibers to be able to talk to all of your organs, to be able to send messages. It is truly amazing. That collagen system is amazing. So when I've seen collagen supplementation on the market, like the highest, best one so far that I've seen is like 9 different types. That all just comprises of hair, skin, and nails. There's 29 different types in the body. So the fact that I can get foundational benefit from that collagen so that my body is supported in every way in this glue that holds me together makes me so excited. I love that so much. The fifth is your immune system. Everyone wants to have a fabulous immune system. They want it to work properly. If they're exposed to something, they want their body to be able to handle it and detoxify it as quickly as possible with the least amount of symptomology. So those are just 5. Like I said, look up GHK-CU and you're going to see a lot longer list. Another thing that's very interesting, which I forgot, sometimes I've forgotten to mention this here lately, but I want to go back to collagen for a second. So collagen in your body actually declines the same way that stem cells do. So by the time you're 60, 80% of your collagen is no longer working on your behalf, which is why, again, sagging, wrinkling, like we see it in the outside. People start losing their hair. It's things that you're seeing on the outside, but it's also that, sagging in the skin all over your body, the weakness, some of those things, things just don't feel like they stay in the same places that they used to. So that is even like the collagen in the, lining of things, the lining of your organs. It's so vastly important. So that declines the same way as stem cells, which is why we have all of these aging effects that happen to us. So that is 5 major systems that are declining in the same order as we age, that are now being supported foundationally at the foundational level to reset us to a younger, healthier state. So the recommendation for how to wear the technology is 12 hours on, 12 hours off. So you put it on your body in the morning when you get up, you take it off at night when you go to bed. And the next morning, you put on a brand new patch, and that's just your normal routine. Put it by your toothbrush, put it by your vitamins, put it by your medication, whatever is going to help you remember to be consistent. Consistency in this world is huge. Having that consistent effort for that GHK copper peptide to get up and get running to regenerate those stem cells is going to have a huge benefit for you if you can be consistent. So what I've talked about is, like I said before, there is a compounding effect in your cardiovascular system. There is also a compounding effect in your all these other body systems that I've talked about. So really and truly, if you don't continue to, if you decide to stop using the technology at some point, doesn't mean that your body's going to reverse back to where it was before. But what it does mean is that you're going to start naturally going down that road of the aging process again, where things begin to not work properly. You can put a stop to that and have a compounding effect in the other direction as you continue to utilize the technology week after week, month after month, year after year. So that is the way I've been using this for over 2 years now. I will continue to do that because I want to have the compounding effects. If someone wants to know, okay, but tell me how long I have to, what should I wrap my brain around? 1 month for every decade you are old. So if you're 50, you want to give it 5 months to really see what it's going to do for you. But again, if you have any kind of conditions, if you're on any types of medications, that 1 month for every decade is not going to be long enough for your body to be able to adjust and get back the things that have been deteriorating. You're going to need more time. So just understand that when we're talking about natural body processes, it's going to take you a while to get down the road based on whatever's gone on. That what's happened with you didn't just happen overnight. So this technology is also not going to happen overnight because we are trying to get things up and working again, resetting them to a younger, healthier state. So really, I tell people, give it 6 months, give it 12 months, go back in and run some of those standardized testing to see what it's doing for you at those 6 and 12 month markers. So just kind of think through that as you're utilizing the technology. Definitely the other thing is that if somebody says to me, I'm just going to try it for a month, Nikki, I will tell them, then just don't waste your money. Because yes, could you feel things in a month? You could, but if you're not going to commit to your health is a commitment. The pursuit of optimal health is a commitment. You need to commit to yourself because you want to have as many years on this earth that the Lord leaves you here to optimize whatever that is so that you're not meeting a new person in your house every 10 minutes, so that you're able to walk up and down stairs for as long as you want to live in the house that has stairs. So really commit to yourself, make a commitment to yourself that your health is important. If we don't have our health, we don't have anything. So our health is so vitally important in taking care of what God has given us and what He has blessed us in these bodies that we have. So, the other thing to consider with this technology is hydration. Hydration is so very important. So, drinking half your body weight in ounces, getting high quality electrolytes and minerals, that's very important so that the cells can talk to each other. The water is what allows the cells to talk to each other. Sometimes people get confused with the hydration aspect as well because they think I'm just talking about for this technology, but that's not the case. For you to have any health benefit in any area of your life, hydration will always play a role in that. You will always have to be well hydrated to pursue any kind of optimal health, to have any kind of reversal in any type of ache, pain, illness, disease, whatever's going on with you. Hydration will always be a key player in that because that is how your body uses its ability to talk from cell to cell to cell, is through the hydration that you give it. So please feel free to ask your questions. You can put those in the chat. You can raise your hand. You can unmute your mic, but we'll take questions for now the next just few minutes. If anybody wants to come on and tell a story, you guys can think through that. I have an amazing story to tell you all tonight. So I just recently, some people that I met, I do some things with a chiropractor and helping him get people started on the technology. And one of his clients were getting ready to go in for surgery. So they've been using the technology, just the x39, for about a month now. The wife is getting ready to go in for surgery. And so I told them to add the Eon, which is our anti-inflammatory patch. Obviously, you have surgery, you're going to have increased inflammation, as well as our carnosine patch, because that helps to repair damage that happens in the body. So that's a master antioxidant in the body. So I had them add that, as well as to have Ice Wave on hand. So she just had surgery. When was it? Oh, I don't remember. Might have been last Monday. Maybe it was last Monday. So he called me today and he's like, I just can't even tell. This is so incredible because I didn't ever hear what kind of surgery she was having, but they were putting her on oxycodone afterwards. So they were expecting the pain to be at a pretty high level and gave them enough supply, like telling them that they're probably going to have to use that for a few weeks. So I mean, I can't even imagine. So very high pain with whatever was going on with this surgery. And then of course, high dose ibuprofen and those kinds of things. So did the surgery, got home, went ahead and patched her the next day, took that one medication just to try to stay ahead of whatever pain it was. The next day, basically, she just asked for an ibuprofen. She didn't want to be on the medication because I don't know about you, but like all that makes me feel bad and I really don't want to have anything to do with it. So I get it. She didn't want to either. Plus the addiction factor that can come with that kind of medication can be devastating in people's lives. So she wanted to try to stay away from that as well. And so she took one ibuprofen is all. They patched with the Ice Wave with all the other patches I told you about, the Ice Wave to break the pain frequency, 2 sets. We used bottoms of the feet and tops of the shoulders. She was not, it completely removes her pain. Obviously, she took one ibuprofen. The third day, okay, should not be going anywhere, doing anything, out anywhere. Her friends came over and got her, and her husband went, he went off to work and basically was like, this is like a jailbreak. Like, what are you doing? You just had surgery. What are you? She's like, I feel so great. I have so much energy. Like, I have no pain. That was the third day in, y'all. I mean, absolutely incredible. He's calling me going like, these patches absolutely work. This is unbelievable. She was feeling great. I mean, all the rest of the week, she's putting on her 2 sets of patches, feeling great, doing stuff around the house. No. Like that's, I mean, obviously when I had my Achilles surgery, I couldn't walk. So that was not going to be happening. But I mean, the fact that there's no way I can't even imagine that because obviously I couldn't get up and walk. But yeah, I wouldn't have wanted to do my surgery without this technology. And that is what they are totally experiencing as well. So absolutely incredible. So thrilled. This is why we do what we do, because we love to be able to help people like this and make a huge difference in their lives. And to have something that will keep you off an addictive medication, I'm not quite sure that there's a price on that, because we're talking about potential months and years of your life that can be damaged from something like that. So to have another option that allows your body to work the way that it was designed, the way God designed it, oh my goodness, praise the Lord. Like that, just absolutely praise the Lord. So yeah, anybody else, please come on. Let me see. Oh, let me see what Tiffany is asking. Oh, so if you miss a few days here and there, how much is that going to interfere with the process? Don't beat yourself up about it. You just start again the next day. That happens to all of us. We all, miss a day here and there. And it's not like you're going to go back or lose what it's not going to happen that fast. So just keep trying to find a way that will help make you more consistent. So I have people who leave half of them even in their house, and then half of them, they take them in their purse or a bag or something that, moves around with them, so that, then it's like, oh, they forgot to put it on at home, but they have the other half, in their bag or at their, workstation at work or whatever, just so you can have half in each place. So if that does happen, you can apply that. So, but it's just working towards consistency, especially with the X39 for sure. So great question. I appreciate it. Let's see. Oh yeah, thank you. Vicky, you already answered. Thank you for asking. Yes, we've all done it. That's awesome. I appreciate it. Anybody else want to come on? Sorry, my little box is like this big, so I'm just like trying to read. Oh, she answered already.
Always have
I
something to
love
share.
it. Yes, I love
Yeah.
it.
But
Please.
yeah, so we have a special water filtration system in our house. And it has like I think it's 9 different filters in it. Anyway, they have to come and clean it and replace certain filters. Well, this gentleman came just randomly out of the blue. We didn't get no notification, and I just had to wrangle the dogs, put them in the family room, and he comes in and that this is why I always pray, because God leads me to certain people. I mean, he's coming to my house, and I always say if anybody's doing service at my house, they're going to be patched.
I love it.
Never fails. There's an opportunity. They're going to be patched before they leave. So yeah, this guy he finished it really quickly and everything, and then out of the blue, I just simply said, do you happen to know anybody that has pain? And he goes, that has what? And I said, anybody that has pain. And he said, oh, yeah. He goes, I know a lot of people, including myself. And I said, oh, okay. So I sent Pastor Ed to do the patching because he was right there and it's the guy. So
Yeah.
yeah, he put the patch on him. He drank a whole glass of water, and he said his knees have not felt that good in 10 years.
Oh my gosh.
10
Wow.
years. And the guy was only 32 years old, but he's had a lot of injuries along the way. I guess he played sports or something. But
Yeah.
yeah, he had back pain, knee pain, I mean, you name it. And he said just bending over and like stooping down, because that's what he has to do to get the filters out of the machine,
Right.
usually like irritates it and aggravates it. And he just kept like doing this because he couldn't. He says, wow, that's amazing. He just couldn't, like, you just can't grasp the concept when it first happens,
Right.
because it's like something so easy as a patch. I
Right.
mean, you just put it on. And I feel
Exactly.
like it takes the guesswork out of it. Like you said,
Mhm.
it goes where your body needs it most.
Mhm.
So I think I have knee pain and I can feel it for sure. It may relieve some of that, but it's going to go to the more important areas first.
Right. Absolutely. Absolutely. I love that.
But I
That's
just love,
amazing.
I love the fact that it works within seconds. And, people's, perception of this is just like, okay, I don't really know what this gentleman was thinking, but he's thinking, maybe this patch, a patch.
Right.
So, yeah, and I mean, when they feel the whole, relief of the pain and the benefits of the technology, that's when, it's more believable when you do your research and you learn about it. So,
Absolutely. Yeah, when you understand what the technology is actually doing. So, for sure. Yeah. Yeah, you're happy, you're feeling it for sure, but it's like, okay, what's actually going on? Like, and then to like really understand, like I said, like the fact that you're getting a technology that really should be worth thousands and thousands of dollars because of what it does, that you're getting it for this such inexpensive cost that's supporting all of these body systems is truly just amazing and such a blessing for sure. Anybody else? Well, that is it. We are actually over our time tonight, but thank you so much for being on. We do this every Monday night, so please invite people to come back. They can ask questions, get some of those questions answered. And we, on Wednesday nights, we do a call that goes through all of our different technologies as well as our business plan. So that's fabulous. And Thursday nights, we usually have some type of testimonial. So you'll get to hear directly from people who are utilizing the technology and the results that they've had. You can listen to all of those calls. We have several of them on my YouTube page is Nikki McCutchen, and then also Patch the Way, our educational site for tons of videos as well for stories, and then all the information, all the patents, all the clinical studies, the links to PubMed, all of those things, even doctors talking about utilizing it with their patients, is on patchtheway.com. So PATCH. Patchtheway.com. So fabulous website to share with people, help get a few questions answered, and then be able to come on a call, Monday night call, and ask some questions. And so thank you for being on the call tonight. So whoever invited you to the call tonight, please get back to them. Tell them that you are ready to get started with this technology now. And with that, we just say good evening and we pray blessing over each and every one of you. Good night, everyone.
good night. God bless.
God bless.
Thanks, Nikki.
Absolutely.